I mean, either you prepare a split thickness flap and then place a frigidular graft or a combination. If a connective tissue graft and frigidular graft, this kind of strip, or you use only a collagen matrix. Okay, look here. Here we have about 2 millimeters. Here too. So what I did is to prepare this split thickness flap exactly the same way. What we did now, you see here, this is keratinized tissue here. I remove the frenulum. This is the periosteum. Then I took the mucoderm, okay, here, and I fixed it. In these cases, I would suggest to use resorbable sutures because it's easier, okay? And then I just fix it to the periosteum and to the keratinized tissue and also apically here. You see? And that's it. And you always leave it to heal open. Okay? And look at the tissue. This is the gain, huh? You see? So this is maybe 5 millimeters gain, huh? It's not so bad. I think it's good. It's easier for the patient. And look at another case. This is a case with implants in the upper jaw. So here, you see a split thickness flap was performed. Here, and everything was filled with the mucoderm. You see here, covered, okay? And fixed. So we had also a small strip of keratinized tissue here, okay? The palate is, of course, keratinized, okay? But all this area here is covered with a mucoderm. Fixed. This is the healing. You see the mucoderm is guiding the keratinized cells, okay? And then it looks like that. Look how nice it is. Huh? And the color is very nice. I think for this is very good indication. But you have to have keratinized tissue. Because if you don't have anything, from anything, nothing will come. Huh? So you have to have something. Okay? But if you have something, it's a very good indication. Okay? Look here. Now, you see how nice it is? And the color. Okay? So I think this is a very good indication. But then you fix it to the periosteum and leave it open. You have to have a large surface. Because the larger the surface, the better the keratinized cells can grow on the surface. Okay? That's it. Okay? So I think for this is more or less the same what we did now here. But keep in mind, you need some source for the cells, okay? Good. We still have time for one more exercise. You want to do one more? Good. Coronal advanced flap with the mucoderm, okay? So I will show you. Just to train also the coronal advanced flap. Or with another collagen, it doesn't matter. So this is just to show you also the cuff. Although personally I prefer the tunneling. But you can also use the, if you like, you can use the coronal flap as well. So we create a recession. So we start with a full, then split, and here we split everything. Here we move we remove the epithelium from the papilla. Okay, Okay, before you pass the mucogingival line,
sau khi mà mình đi qua khỏi
we prepare a split thickness flap. Okay?
thực hiện một cái vạt bán phần.
That's why you need to use very sharp blades.
Mình cần phải sử dụng những
Always change the blade.
dao thật là sắc bén, luôn luôn đổi những dao mới. Ban nãy em không chắc là em có nghe nhầm hay không, nhưng mà cái vùng ở phía bên trên, cái vùng trên của đường ống nước mạc là đã toàn phần và đi qua khỏi đường
So
ống
this flap has to fly. Okay?
cái vạt này sau khi mình giảm căng thì nó sẽ
It's the same as tunnel approach. Huh? Maybe it's going faster,
có thể là nó sẽ
but then you have to suture. In patients, it's more difficult if you have very thin tissue.
nó sẽ khá là khó.
But the secret is also here, the same concept. You have to release.
Cái ý tưởng này nó cũng sẽ giống như nhau.
So
Cũng giảm
remove
căng,
the
có thể đưa cái vạt về phía thân răng.
the epithelium.
Mình lại khởi nhớ là
Okay, then you take your collagen.
cái nướu, mình lấy một cái miếng collagen.
You can even put some endogen on the collagen or PRF, IPRF. Okay.
Hay là endogen hay là IPRF.
You can use now your rest of your mucoderm.
Thì sau đó mà mình có thể
And then you just use the same suture, the same what you did for the connective tissue, always the same. I like to use the sling suture because if you learn it once,
cũng sẽ
you can always do it.
dùng những cái
It doesn't matter what kind of technique you use. Always sling suture tuck is very easy.
những cái mũi treo này rất là hữu dụng, tôi rất là thích dùng cái mũi treo.
Here I can also pass through the papilla if I want,
Ở đây mình cũng có
because I don't want to pull it too much coronaries. Because the big difference between connective tissue and collagen
cái sự khác biệt của cái miếng
is that we never leave exposed the collagen if you treat a recession.
bao giờ để
The
lộ
collagen can only be left exposed if you want to gain attached mucosa, keratinous tissue,
để
okay?
lộ nó trong miệng.
Otherwise, don't leave it
Ban nãy
exposed.
tức là khi mà mình muốn gia tăng vùng núi sinh hóa, khi ban đầu đã có núi sinh hóa thì thôi.
How do we close this flap?
Thì làm sao mình có thể khâu
Simple. Another sling suture. Go to the apical part of the papilla,
tương tự
pull it coronally. But now, of course, you don't pass
cái gai nướu giải phẫu này vào
through the connective tissue of the papilla.
xin lỗi cái gai nướu phẫu
You
thuật.
capture the flap only mesially and distally.
Và sau đó thì mình sẽ treo nó vào
And that's it.
phía xa. Rồi
You can bring, and I go as much as possible coronally, over contour with about 2 millimeters.
thì
Okay, because this will go back anyway, but I want to be sure that the entire collagen matrix is covered.
miếng collagen của tôi được che phủ hoàn toàn thì tôi sẽ phủ cho
And when we start to suture the verticals,
từng cái miếng collagen bên dưới,
we start suturing from apically and we move very gently coronally.
khâu từ cái chóp.
And when I start apically, I always start to capture the periosteum as well. Huh?
Khi mà mình khâu đến những cái vùng này nếu mà phải thì hãy đứng nó vào màng xương.
And always make sure that
Và hãy
you
luôn
don't capture the collagen.
mình không có
With
đâm
your needle.
vào cái miếng collagen.
Okay? With the needle, you only capture the flap.
Mình chỉ có đâm qua cái vạt thôi. Ban đầu em hơi chủ quan là cái này không phải là cái thuật cs của Sculean, tại vì nó có quá nhiều những cái biến đổi và thay đổi so với cái thuật của Sculean. Có lẽ mình nên gọi nó là cái thuật cs của Sculean hay hơn.
Okay? So that's it.
Rồi, đã xong.
Hết phim.
Hết pin rồi. Hết xài quá hết pin rồi.
Dạ, xong là
Okay.
hồ luôn, chặn chích xẹt luôn.
So if you want to do it, you can also use the molar. Take some new blade
Đổi thử dao mới nha.
and the rest of your collagen, huh? And the rest of the
Cái
molar.
phần mô đơn còn lại.
Anh làm đi, mày làm.